All right. Hello, everybody, and welcome back to CCA's Medical Minute. It's been a while since we've done one of these. We got a little flabby and fat over the winter, I think, over the Christmas holiday. But the good news is that gave our Chris McNeil, our videographer, gave him some time to redo our studio. So you're coming from a brand new studio, which is kind of fun.
Yeah, it is.
We no longer look all buttoned up. We look all casual now. Just talking about we might need a fireplace in here. I don't know. We haven't done that yet, but really happy. The podcast continues to be sponsored by Kroger Health, our great partner. And speaking of which, we're here with Connie Palakodeti today, who is the regional clinical director for the Little Clinic. And so you're going to tell us kind of what your region is and a little bit more about what you do, and then we'll talk a little bit more about some of the screenings and different things that you can do at Little Clinic and how that all ties together with your overall health care.
Mm-hmm. Sounds great. Well, first of all, thanks for having me. As you mentioned, I am Connie Palakodeti. I'm the territory clinical leader for the Little Clinics. My role and responsibility are all things clinical operations. So I oversee our 225 clinics across 9 states. So really exciting to be able to bring new healthcare to people in the communities who really need it, outside of just that general primary care office 9 to 5 Monday through Friday look.
So Connie, what's new with what you're doing as we kick off 2024? I know Little Clinic and also Kroger Health, there's a lot of different kind of screenings, and first of the year people are trying to get those screenings. First and foremost, what's available, and is a screening different from getting a physical?
So when it comes to screenings, there are all kinds of screenings out there, right? So there's blood pressure screenings, there's cholesterol screenings, there's mammogram screenings, colorectal cancer screenings, all diabetes screenings. The question really becomes, what do you do with those screenings when you get them done? And to your point, is it different than a physical? The answer is yes, but many times you'll see those incorporated with your physical because it's great to get those screenings completed, but the question is, what do you do from there, and how do you formulate a plan if something's wrong with those screenings? So at Kroger Health and the Little Clinic, we can order multiple screenings for anybody who fits into the specific age groups that may be recommended for their ages. And then on top of that, we offer an array of primary care. So no different than if you were going to your primary care office, we do the same type of primary care inside of our clinics. And I think that kind of correlates to exactly what you asked. What is different at Kroger Health? What are we doing in 2024? One of the first things that comes to mind is our launch of value-based care, which is elderly population care that is out there. And that actually just launched as a pilot in our Atlanta division. So we are looking forward to bringing more convenient care that's 7 days a week to the elderly population out there.
And so, Connie, how does that differ? I mean, obviously there's people at different stations in life and different problems, but in terms of how you market that and how you segment that demographic, how do you guys act differently? How are you going to get them in? What's your approach, I guess, on that?
Yeah, so that's a great question. Obviously with flyers, as well as, working with their Medicare Advantage plans that we use to be able to allow them to enroll and be a part of our care here at the Little Clinic with our providers there in the Atlanta region. But more importantly, obviously, actually right now, as going on, they have a couple open houses inside of the Krogers down there that are going on, really welcoming the community to what's going on out there. So a lot of hands-on grassroots marketing, which we know is the best way to do it for people to really understand.
So where does it go once a person comes in and participates and gets a screening or what have you? From that point on, you're then going to collaborate, or you're going to work with their primary care provider? Or walk us through that process for the patient, because oftentimes what happens when you go into your physician's office, but when you're coming into the Kroger, sometimes people think it may perhaps be just a little bit different.
Yeah, so if a patient is either a walk-in at any of our facilities or they schedule online at Kroger.com to be able to be seen for any type of screening that is out there, we have 2 approaches, right? Obviously, if they have a primary care doctor, we're going to work hand in hand and share that information and kind of pass off that care of that patient to their provider. However, we all know post-COVID and the pandemic, there's not really that many primary care providers out there anymore. And I think that's where retail health and what the Little Clinic and Kroger Health are doing so well is, allowing people to come into the grocery stores where they always shop, right? It's very convenient for them. And we have quality care family practice nurse practitioners or physician assistants there to be able to host their primary care needs. So if they get a screening and they don't have a primary care, we 100% can fulfill that role for them. And I think that's the key that a lot of people don't realize outside of retail health. It used to be cough, colds, those types of things. But with the expansion of what healthcare is going for and us really trying to change the way healthcare is delivered in America, we've expanded our scope of service to be able to offer primary care.
Let's rattle off some of those screenings. I mean, if a person needs to come in for, of course, get their blood pressure checked or whatever, is that considered a screening, or perhaps maybe cholesterol, something of that nature?
Yes.
What could they expect? Because you say screenings, but sometimes people don't always, know what that incorporates.
Sure. So, you mentioned a couple of blood pressure, cholesterol. You can do mammogram screenings, colorectal cancer screenings, diabetes screenings. You basically can almost get screened for anything. Lung cancer screening, skin cancer screenings.
Yeah, I was going to ask about the cancer aspect of it. So have you guys recently partnered with one of the, the healthcare providers here in this area for some of those initial types of screenings like breast screenings?
Yeah, so we do actually with Mercy Health have a mammogram truck that comes to certain locations.
Really
have
nice,
you seen that?
Yeah, I've seen it. It's really cool.
For patients to be able to get their groceries as well as get their mammograms without having to go to a hospital location. So we have done those types of things. We also have a relationship with Kettering Health, as well as some stuff that we're building with the University of Cincinnati to be able to kind of refer people. So, if it's outside of primary care or, let's say one of those cancer screenings are positive, how do we get them to a specialist? We have all of those referrals built in currently, and those referrals will go to, the hometown providers that are there so that patients aren't necessarily having to drive a long time to be able to get that care.
Okay. So obviously you can do blood-based tests because that would be cholesterol, right?
Correct.
Okay. So then with that in mind, and to Sherry's point on cancer, I don't think you guys are doing that yet, but would you ever envision a day where you could do like liquid biopsies and things like that, which are kind of all becoming critically important to cancer care and treatment?
Yeah, absolutely. So we do have the ability to swab for certain things, but when it comes to true biopsies, we're not quite there yet. I would imagine in the future of Kroger Health that would become an expansion of our scope of service, especially as we continue to build up value-based care and some of the relationships that we have out there.
Yeah, Connie, lately mental health has become so critical. And I'm wondering, do you do anything along those lines, or do you provide any referrals? If not?
Yeah, we actually at the Little Clinic, we're one of the first retail health centers to actually do mental health screenings. And I know sometimes as a patient, you come in and you're like, I have a cough or a cold, and then the provider is asking you, do you feel well? Like, have you ever had bad days? Those types of screening questions. And I'm sure most patients are like, why are you asking me this? I'm here for X, Y, and Z.
But that's a mental health screening already.
Right.
Kind of built in.
Right. But the reality is not asking those questions, we lose a lot of opportunity that may walk out the door that people may either A, not realize maybe they're having some mental health issues going on, or B, they're afraid to come to somebody and actually admit that. So sometimes we try to get into that by asking the PHQ-9 or PHQ-2 questions that are standard practice that are out there for mental health that you may see in your primary care or any type of mental health provider office. And then if that's the case, and let's say they are positive, right, on their mental health screenings, we 100% can see those patients and be able to start them on some type of medication if that's what's needed, offer behavioral health and refer them out, really just depending on what the patient's needs are. But we can help those caring services for those patients really start on something and start feeling better right away.
What you just talked about, are those a series of questions?
They are a series of questions,
Okay.
yes.
Assessment.
And they're very basic, have you ever, do you feel, bad more days than not? Those types of questions. And then depending on how the patient would answer those, it would open up an additional series of questions.
Okay.
If they, answered no to both of the typical screening questions.
So this is interesting. I mean, if you don't mind me asking, so like for example, when I go to my oncologist, they always ask me like, do you feel threatened or are you concerned about anything? Or is that similar to that?
It is similar to it, but that is probably part of like your social history that we take.
Gotcha.
A lot of times we'll ask about alcohol, tobacco use. Do you feel safe at home? Those types of screening questions. But that is outside of the typical normal expectation for behavioral health or mental health screening questions.
What do you want people to know most, Connie, about the services that are available to them? There's so much that you guys do. But sometimes, people have a fear of going to doctors or seeing clinicians because they know that there is something wrong, and sometimes they, quite frankly, just don't want to know what it is. So what do you want them to know most about the care that you all are able to provide?
Yeah, I think, first of all, I mentioned that we are board certified family practice nurse practitioners and physician assistants. NPs for the last couple of years have been one of the most trusted positions out there. And so we are there. Originally we were all nurses at the start. We're there to help educate patients. And I think that sometimes gets lost out there for patients. They lack that education piece that maybe some providers may give them. But first and foremost, a patient has to be ready, right? And has to be willing to make a treatment plan for themselves, because I can tell you to exercise and lose weight and eat well and do all of the things. But if you're not ready, then we have to make sure that that treatment plan is going to meet the patient's needs.
Yep.
So I think that's one thing that we do really well at the Little Clinic is kind of meet patients where they're at. We really do understand that, unless we have an agreed on patient care plan with that patient, then the odds of them adhering to that care plan is probably slim.
Right.
Gotcha. So I want to ask you, this is near and dear to my heart.
Sure.
Prostate cancer screenings. Yes? No?
We do. We can do some prostate cancer.
You can do PSAs and things like that?
Yep.
Okay.
We can do those types of things there.
This is very informational, because a lot of people don't often think of that, And so while you're stopping into the grocery store and you're thinking about what's going on with your health, it's a whole different thing to be able to say, I'm going to walk on over and maybe ask one of the clinicians, I'll go to the Little Clinic. And you can actually do that. And of course, there is full confidentiality as with any type of medical practice.
Of course.
And it's the and Connie, I think about like within the medical systems, like which are based with Epic, and then how that all ties into MyChart and things. What happens here? Does that get tied into your medical records as well?
Yeah, so we actually at the Little Clinic and Kroger Health are part of the health information exchange that is out there. So as long as a patient opts into us, our health information exchange, and they have also agreed on the other provider side or the health system side to be able to do that, all of our medical records are out there for their other providers to be able to see.
Okay.
So you know what? When I leave here today, I'm going over to the Little Clinic because I got round 2 of the shingle shot to finish.
Oh yes, please do.
It's funny. I mean, honestly, part of this for me is curiosity, because I actually work in a little clinic called Cincinnati Cancer Advisors.
Yeah, that's right.
So I'm a 10-year cancer patient, and then so I've got a whole flock of people here that are tending, mothering me the whole time, and so there's never a screening I'm going to miss because of that. But it's just it's a new way of thinking that I could be going in to pick up something for dinner, but maybe if I've got the time, I could actually knock out a screening while I'm there. It's not. I don't think in those terms because I get it, that care outside of there, but to know that it's available is kind of a revelation.
And Chris, do we have time? Okay, let me ask one more thing. Okay, we know you can go in. What about what it may cost for a patient? Are there free screenings, or are these all insurance-based screenings, or is there help for people that may need to be able to get these screenings if they don't have insurance or things of that nature?
So for those who are not insured, we do have prompt pay pricing, and that self-pay pricing is on our website, so it is very transparent out there of what they would cost. Blood pressure screenings we do for free at our facilities, but most other screenings come with a visit, just because there has to be some evaluation of what that screening shows and what do we do with the patient after that.
And I fully understand that. I just didn't want people to think that, hey, I'm just going to pop into the Little Clinic
yes, 100%.
and line up and walk out, and that they don't have any skin in the game. So, thank you so much for clarifying that and letting folks know that there is help if they need it.
Yeah, and I think, that's to your point. A lot of people don't realize that, that convenience is there. And we are open 7 days a week. So being able to either go online to Kroger.com or just walk into a facility to be able to get not only screenings, but chronic care or mental health. People think about us as, oh, I'm sick, I can't get into my doctor, let me go there. But the reality is we're much, much more. And I think the one thing that has been really hard to find nowadays because of cost is a lot of primary cares are not carrying vaccines, and our pharmacies as well as our clinics carry almost every single vaccine you can imagine.
Like you go to your PCP and you maybe can't even get the vaccine,
or there's some PCPs that are actually referring to retail health or the pharmacies for those vaccines.
Or if you're heading out of the country?
Yes. Yes, we do all travel vaccines, which travel vaccines are very hard to find outside of the health department. So instead of having to go downtown to the health department, we do carry the majority of travel vaccines too.
You are dropping the knowledge today.
Yeah,
trying.
This is great stuff. I'll just do one more question. It's something Dr. Barrett, our founder, and I were talking about a couple weeks ago, but I know something that he's really focused on is trying, because you mentioned colorectal screenings before, but as you might have seen, and it's kind of puzzling, but a lot of the incidence in young people is increasing, and whether that's gut biomes or bad diet or whatever it might be, but they're trying to get beyond that. But like one thing Dr. Barrett and I were talking about was trying to get more, because it's hard to get people to a colonoscopy sometimes. Maybe they're not even age qualified at some point in time. But I know he's really interested in some sort of distribution strategy for like Cologuard or something like that. Is that something you guys could ever see yourself doing?
Yes, that is something that actually has been on the table that we've talked about quite often. We have had some providers order it, if a patient asks, but that is definitely something, that is on the table for us to be able to order for those patients who really don't want to go through that full colonoscopy, but may just want that basic screening to figure out, do we really need a colonoscopy?
Right.
And kind of go down that route. But I think, you just mentioned, and it triggered me, one of the other things outside of value-based care is that Kroger Health has started clinical trials. So we made announcement for clinical trials. And one of the clinical trials that we're doing here in the one of the regions here in Ohio is actually for colorectal cancer. And so those things are all common knowledge out there on the website for people to look up. But it is really exciting that we're getting into the world of value-based care and clinical trials outside of regular healthcare. Truly, as our president says, changing the way healthcare is delivered in America, because we know it's not working right now the way that
Steve,
it is.
I see another medical minute.
I think so. Because this whole clinical trial thing is really interesting too, as far as how that.
We'll be talking to you guys about that.
Absolutely.
Yeah. No, this has been great stuff. I mean, I learned a good amount today as well. If I didn't already work in a little clinic, I'd probably be coming out.
We'd hire you for sure.
But thanks for coming out today, Connie. Really great stuff, and really exciting to hear what you guys are doing. I think that just from an editorial standpoint, I think it's just the ability for people to take care of something while they're doing something else instead of it having to be a separate step is really huge. I mean, I think because people are busy and
convenient care.
Yeah, exactly. It's good stuff. All right, well, thanks for coming out. Thanks for you're our inaugural guest in our new studio.
No, that's so exciting, right? This was great. I loved
Hopefully
it.
we don't look too awkward, like handling microphones and like where like my socks now show and stuff. So it's like we got to up our game a little bit, I think. But thanks for coming out.
Thanks for having me. I enjoyed it.
Thanks to Chris for redoing our studio. The guy was hanging wallpaper this weekend. So anyway. All right. Well, thanks everybody. It was great to have Connie out today, and we're going to get a little bit more regular with our cadence again in 2024. We're actually back to work again, so we'll see you again soon. Thanks.